On mycology. Let's start by appreciating how fascinating fungi are, from the mushrooms we see in nature to their complex roles in ecosystems. This introduction sets the stage for exploring fungi in depth, covering their biology and importance. Fungi are truly a double-edged sword. On one hand, they help decompose organic matter, assist in food production like bread and cheese, and have vital roles in medicine and biotechnology. On the other hand, some fungi can cause infections in humans, which makes understanding them crucial for health. It's important to understand how fungi differ from bacteria. Fungi are eukaryotic, meaning their cells have nuclei, while bacteria are prokaryotic. Fungi prefer slightly acidic environments and can grow at various temperatures depending on their type. Their cell walls contain chitin, unlike bacteria, which have peptidoglycan. Also, fungi are resistant to some antibiotics that affect bacteria, which impacts treatment choices. Fungi can be classified by their shape and growth form. Some grow as yeast, which are single cells reproducing by budding. Others form molds with thread-like structures called hyphae. Then there are dimorphic fungi that can switch between yeast and mold forms depending on conditions. This morphological diversity affects how they live and cause disease. Looking closer under the microscope, fungi show distinct structures. Yeasts appear as round or oval cells, while molds have filamentous hyphae. For example, Rhizopus has specialized structures for spore formation visible even on moldy bread. Some fungi can change form in response to temperature, shifting between environmental and parasitic forms, which is key for their survival and pathogenicity. Fungi are classified taxonomically based on how they produce sexual spores. Ascomycetes form spores inside sacs called asci. Basidiomycetes produce spores on club-shaped structures called basidia. Zygomycetes have non-segmented hyphae and form sporangiospores. Deuteromycetes lack a known sexual stage. This classification helps us understand their biology and relationships. Fungal spores come in many types, divided into sexual and asexual categories. Sexual spores include zygospores, ascospores, and basidiospores. Asexual spores can be vegetative, like blastospores and arthrospores, or aerial, such as conidiospores and sporangiospores. These spores are crucial for reproduction and spread, influencing how fungi colonize environments and hosts. Fungal infections, or mycoses, are classified by how deep they penetrate tissues. Superficial mycoses affect the outer skin layers, while cutaneous mycoses invade deeper skin. Subcutaneous mycoses enter through wounds, systemic mycoses spread throughout the body, and opportunistic mycoses mainly affect people with weakened immune systems. This classification guides diagnosis and treatment. Superficial mycoses affect the outermost layers of skin and hair. Conditions like pityriasis versicolor cause discolored skin patches, while tinea nigra results in dark spots on palms and soles. Black and white piedra affect hair shafts with nodules of different colors. Yeast infections can affect mucosal surfaces, such as thrush. These infections are generally mild, but can cause cosmetic concerns. Cutaneous mycoses invade deeper skin layers and sometimes nails. Candidiasis affects skin folds in nails, often in infants. Ringworm is caused by dermatophytes and can appear on various body parts. Angular cheilitis involves mixed infections at the mouth corners. These infections can cause itching, scaling, and discomfort, requiring appropriate antifungal treatment. Subcutaneous mycoses enter through skin wounds and cause chronic infections. Chromoblastomycosis produces warty nodules from pigmented fungi. Sporotrichosis spreads along lymphatic vessels, causing granulomas. Mycetoma leads to swelling and draining sinuses. Rhinosporidiosis causes polyps in the nose. These infections are more severe and often need long-term management. Diagnosing fungal infections involves collecting samples from affected areas like skin, nails, or mucosal membranes. Microscopy techniques, such as KOH preparation and special stains, help visualize fungi. Culturing the fungus confirms the diagnosis. Accurate identification is essential for effective treatment, as fungal infections can mimic other conditions. Rhinosporidiosis is a chronic granulomatous disease marked by large polyps or wart-like growths. Although first identified in Argentina, most cases are reported from India, Sri Lanka, and parts of South America. In India, certain regions like Orissa and Kerala are known endemic areas. Understanding its geography helps in recognizing and managing this disease. The exact way Rhinosporidium seaburi infects people isn't fully known, but dust and water are suspected sources. The disease causes large friable polyps mainly in the nose and eyes, but lesions can also appear in other body parts like ears and skin. These lesions can be troublesome due to their size and location, highlighting the importance of early detection. Clinically, rhinosporidiosis presents with large reddish polyps in the nose that can bleed or cause obstruction. Under the microscope, tissue shows numerous large spherical sporangia filled with endospores. These structures are key to the fungus's life cycle and help confirm diagnosis. Recognizing these features is crucial for appropriate treatment planning. Laboratory diagnosis relies on identifying sporangia of Rhinosporidium seaburi in tissue sections stained with hematoxylin and eosin. These sporangia range from 10 to 200 micrometers and contain smaller endospores about 6 to 7 micrometers in size. When released, these endospores develop into new sporangia, perpetuating the infection cycle. This microscopic confirmation is definitive. Treating rhinosporidiosis often requires surgical removal of lesions, especially for localized growths. Medical therapies include drugs like dapsone and amphotericin B, among others. As rhinosporidium does not grow well in the laboratory, testing treatment options has been a challenge. Recurrence can occur in most cases, so combining surgery with medication and follow-up is important. Effective management depends on accurate diagnosis and tailored treatment plans.